Okay, so we are live on YouTube and now I'm recording GoTo and we are game.
This conference will now be recorded.
Okay, welcome everyone. This is Monday, March 22nd at 3:01 p.m. and I am calling to order the Lincoln County Board of Commissioners meeting. This is a regular meeting being held virtually. And the first item on our agenda would be to establish a quorum. We have all three commissioners present. Next item on our agenda, if I can get Casey to roll down, would be adoption of the consent calendar. These are items of a routine nature or items that have come before the board before. If staff or commissioners wish to highlight an item, they may do so now. Otherwise, I will entertain a motion to adopt the consent calendar as presented.
Mr. Chair, I move for adoption of the consent calendar as presented.
I will second that motion.
All those in favor say aye. Aye.
Aye.
Aye.
All right. Next item on our agenda is a public hearing, but I believe we're going to postpone that. And Council Urbidge, I believe you'll give us an update and then we'll have a motion to postpone the public hearing.
Thank you, Chair Hunt. For the record, this is Jerry Herbage, Assistant County Counsel. And I would ask the board to postpone the reading. In reviewing the matter, it appears that the notice to DLCD required by a post-acknowledgement plan amendment was not previously done, so that needs to be taken care of. Actually, notice was sent last week, so I think the Planning Commission will be meeting April 26th. We'll check on that. But I would ask the board to make a motion to remand this particular case file, which is 01ZC PC-20 with applicants Kyle Humphreys and Ashley Humphreys to the Planning Commission for purposes of curing procedural issues. This we have run by the attorney for the applicants and Tracy, and she has okayed that as well. So that is, I think, the proper procedure. Tracy McDowell.
Any questions from commissioners? Otherwise, I'll entertain a motion. I believe we have specific language.
Mr. Chair, I would move. Oh, go ahead, Commissioner Jacobs.
Go ahead, Commissioner Hall.
Okay, I move to remand case file number 01-ZC-PC-20, applicants Kyle Humphreys and Ashley Humphreys to the Planning Commission for purposes of curing procedural issues.
I will second that motion.
Okay, it's been moved and seconded. Any other discussion? I will comment that Tracy McDowell at one time was a teller that worked with me at Umpqua Bank. So she has obviously gotten a law degree since then. So congratulations, Tracy. And with that, I'll call for a vote. All those in favor say aye. Aye.
Aye.
All right, that motion carries. Thank you.
Thank you, Commissioners.
Yeah, thank you. We'll move along now to reports, and as has become customary, we have Florence Portal, our Deputy Director of Public Health at the moment. Florence, give us an update.
Hi. Oh, thank you, Casey. I'm glad that made it to you on time. Good afternoon, everybody. Florence Portal, Deputy Director of Public Health. So we'll start with our COVID-19 cases that have been reported to us. And as you can see on the graph, we were doing really good at the beginning of February and held steady for a month. And we're seeing an increase in the cases have been reported to us in the past few weeks. And at this time, we have, I believe, 50 cases for the month of March. out of those 50 cases, we have 7 outbreaks. The main outbreak has 10 cases associated with it. And then we have outbreaks with from 3 to 6 cases associated with them. You can scroll down. So we discussed the number of cases for March. You can go down.
So Florence,
Yeah.
excuse me, I may have missed, but did you say what appears to be the source of or the cause that we're seeing in the rise in cases?
We're not necessarily a source nor a cause. What we see that we've had a few, we've had cases associated with a birthday party. We had cases at a restaurant. We've had cases associated with sport practice. So, you know, I'm gonna make an assumption that maybe there was not mask wearing or physical distancing in those situations. But there is no really, like a few outbreaks are kind of linked to each other, but the rest of them are not. They're like independent events, if that makes sense.
Yes, it does. So I guess my next question would be, do you expect us to move to the moderate level this Friday, or do we get a 2-week reprieve, which is, I guess I understand the case when counties go from a lower risk level to a higher risk level?
Yes, so the latest guidance from the Oregon Health Authority, and so this is with the caveat that I sent an email to our counterpart at the state this morning to confirm the cautionary period, and I'm yet to receive a response, okay? But based on the email I had sent you last week, I believe, our understanding is that we will be granted a 2-week cautionary period. And I believe the reason for this is to see if this is just gonna be a little flare and that we're gonna come back down, or if we're gonna maintain that trend upward. And if we maintain the trend upward after the 2 weeks cautionary period, then we would move to the next risk level. If I hear otherwise, I will of course let you know as soon as I receive an email from Dana Drum.
Okay, I'll ask my other commissioners, give them an opportunity at this point to ask questions. Claire, Commissioner Hall.
Thank you, Commissioner Hunt. Let's see, Florence, my first question would be, again, you know, if you look at social media, people have been watching these numbers creep up steadily, and you know, and one thing I keep hearing again and again, oh, it's got to be the visitors. Oh, the towns are packed on weekends. It's got to be the visitors. But when you're talking things like birthday party and sports practice, that seems like these are local people, local activities. Is that fair to say that this is where most, if not all, of the new cases come from?
It is fair to say.
Okay. And again, we are waiting for word from Oregon Health Authority, but if there wasn't the potential for this grace period, well, 2 questions related to that again. That's strictly their call in consultation with the governor. We have no say on that. Is that correct?
We do not have a say on that. Yes,
Okay.
that is correct.
But if the possibility wasn't there of the grace period, these numbers would put us up a notch, correct?
That is correct. Yes,
All right.
if we didn't have the 2-week cautionary period, we would be moving to moderate risk category.
Yep.
Correct.
Okay, that's what I had. Thank you very much.
Thank you.
All right, Commissioner Jacobson.
Yeah, thank you. Claire actually asked a couple of the same questions I was going to ask, or Commissioner Hall rather, but one remaining question is, when would, if granted, when would that 2-week cautionary period begin? Would that officially start like this Friday?
I would think you would take into consideration the 2 upcoming weeks. So I would say starting on, so when did we stop this one? I believe on the 20th. So starting the 21st and then for 2 weeks.
Okay.
I mean, at least this is not extremely clear as usual, you know.
Yeah.
This is how I understand it.
Okay,
But
well, I would ask,
like I said, I'll make sure that I forward you the email I received from the state with hopefully with some
Yeah.
clarification.
I would appreciate that. I think it would just be helpful for the public to know when we're in that cautionary, if we get in that cautionary window, you know, when those 2 weeks begins and ends, because what data that we're using to get out of it, you know, depends if it's Monday to Monday or Sunday to Sunday or whatever it is. So that would be helpful. Thank you.
You're welcome. And so I just want to, maybe remind people, right? So this is the week of spring break. I know people are getting antsy to go places and get out of the house and enjoy themselves. And it's absolutely fine as long as, you know, we keep wearing our mask and remaining physically distant and staying home if we have any type of symptoms that could be COVID related, and practicing good hand hygiene. I mean, you know, nothing new from what we've been repeating for the past year. And I think it's important that we do that, otherwise we might see cases come back up again.
Yeah, I would add that I think certainly there's some evidence that just because people are getting vaccinations, it does not mean we change our habits, which have kept us at a low level, risk level, i.e. wearing masks, social distancing, washing our hands. Those are still critically important, even though people are getting vaccinations. So back to you, Florence.
The vaccine is really a great tool to avoid, you know, severe illness, hospitalizations. It doesn't mean that it protects us 100% against getting COVID-19. So all of those practices are very important. Indeed. All right, well, you can scroll down, Casey, if you'd like. So in terms of vaccinations, we're doing really good. We're county number 3 in the state of Oregon for the proportion of people in our county who have received at least 1 dose of vaccine. We are at almost 15,000 people. So that's very exciting. You can scroll back down a bit. So we are definitely feeling the beginning of a surge in how many vaccines we're receiving this week. As you can see, we were told, and those are only first doses. So we're receiving 1,100 doses of Moderna this week, and there was an additional allocation of Pfizer to the Samaritan system, and so we're taking 100 of those doses on top of what Samaritan is going to administer over the weekend. So that's a total of 712 doses of Pfizer. North Lincoln Fire is receiving 500. The pharmacies 200, and this is just counting pharmacies that are receiving vaccines directly from OHA. I believe Safeway pharmacies and Walmart pharmacies might be receiving doses directly from the federal program. And then our partners at the Steelitz community centers are also receiving 300 doses of vaccine. We are getting 900 doses of second doses. This week we are going to be busy. We have, check. We have 9 clinics scheduled this week. which is really exciting. It's a mix of first and second doses. When we were notified on last Thursday that we will get 1,100 doses, we decided to add first doses to our second doses clinic to make sure that we would administer those doses and that we would get them out to people as fast as we could. So that's going to be an interesting week, I believe. We are also getting our first clinic at Wildfire going on Thursday. We're planning on scheduling 250 individuals for that day. And the week after that, we will alternate and do a clinic on Saturday at Wildfire. So we will alternate Thursdays and Saturday every other week. What else?
Florence, could you comment on the Group 6 opening vaccinations to Group 6, please?
Yes, of course. So what happened last week is that we being the entirety of partners who have been administering vaccine and who've been using the wait list where people can register, what we experienced is that not only the schedules were feeling slower than they had been, and also I think over the course of the weekend we received like over 1,500 emails from people telling us, "Hey, already got vaccinated. Thank you. Can you take me out of the wait list?" So what we decided to do was to ask, mostly to let the governor's office know that it seemed that the 65 plus population had been kind of like saturated in the community, and that we wanted to make sure that we were also opening up to the next group, which is adults 45 to 64 with one or more underlying health conditions, and migrant and seasonal farm workers. So this request was acknowledged on Friday, and so we are opening the schedules to this population and starting today.
Thank you.
You're welcome. So I think this is mostly what I've had. I don't know if you have any questions or specific points that you would like us to discuss.
I think Commissioner Jacobson has a question or two.
Yeah, thank you. I have three actually. So my first question is, previously when we were doing ages 65 plus, we got clarity that if you were 64 but turning 65 in 2021, that you are eligible now. Is that the same when we say adults 45 to 64 with health conditions? If you're currently 44 but turning 45 in 2021, are you?
I would say yes.
Okay, great.
Let's be consistent.
Okay, and then also, can you spell out what those one or more existing health conditions are?
I can't find them. All right, here I've got them. Cancer, chronic kidney disease, COPD, Down syndrome, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, immunocompromised state from solid organ transplant or HIV, obesity with a BMI greater than or equal to 30 kilo per square meters, pregnancy, sickle cell disease, and type 2 diabetes. And we could put that on the website if it's not already on there.
I think, yeah, if it's not already on there, I think that would be helpful for people to actually know what those, health conditions are, and how exactly they qualify. My other question I had, which was a question from a community member, similar to kind of the age questions I asked previously, the Pfizer vaccine, is already emergency approved for 16 years and up, is my understanding. And again, is that, after your 16th birthday? Is that if you turn 16 in the calendar year? Do we have some clarity on that?
I would say on this one, you turn 16.
Okay, different than the other ones.
Because I think the study, right, I think the studies were done on folks who were already 16.
Okay, all right, that's helpful. All right, that is all of my questions. I do have a comment, though. I think as of the 3rd, I got an email from Amy Snyder that we will also starting to be vaccinating wildfire survivors, which wasn't on here. So that is all happening.
Yes, this
No, it
is
was an email from you. I'm sorry, it was an email from you.
Yes,
Yeah.
it was from me. So we will, we're setting up a clinic in Otis for April 3rd. And this is going to be in partnership with our friends at the North Lincoln Fire and Rescue. And then we're also working on some special outreach clinic to our migrant and fishing communities. And hopefully we're in conversations with OHA to make that happen the week of April 2nd and 3rd. And we're hoping to get a special allocation of the Johnson & Johnson vaccine to make it easier for people to access the vaccine and then be able to go about their work, or if they need to go to sea. So more to come. We should have more information on those specific clinics at the next Board of Commissioners meeting next week.
All right, thank you, Florence. Any other questions or comments from commissioners? All right, any last comments, Florence?
No?
All right. Thank you.
Thank you.
All right. I'm going to have to walk over to the door. I've got a cat that's insistent on getting in the room or it's going to tear the carpet up. But with that, I'll allow a second for the Echo Mountain Complex update. Is that Director Kenyon or Council Belmont?
This is Wayne Belmont, County Council. I'll start off, then bring in Director Kenyon or Casey Miller to talk a little bit about it. So first and foremost, just we're finalizing now the information we're getting on the Municipal Wildfire Assistance Grant that we received and getting the programs underway there. That was funding that came through Business Oregon to the county for some activities that we're already undertaking, but some that we're going to do in the future. That covers both this fiscal year and basically a promise to cover the next fiscal year for these particular activities. And then we heard last week that there is included in a legislative funding bill money to Lincoln County for basically, I'll call it infrastructure kinds of activities that we're going to undertake related to wildfire and to some of our mental health services providing to survivors. That is included in a bill that looks like it's going to provide us with some money. We don't yet have, I don't think unless Commissioner Jacobson knows a specific date, not sure when that money is going to be made available to us, but it should happen this fiscal year. And then I think that Director Kenyon or Casey Miller can provide us with some updates on the debris cleanup activities. I know it's well underway now, and that's one of the updates we try and give each week. So I'll turn it over to them to see what they can offer.
Good afternoon, Roy Kenyon, Lincoln County Public Works Director. I was up there, Echo Mountain Fire area last Thursday. A lot of activity. Things are continuing to get cleaned up. It's actually amazing how many new homes are coming back in. Things are starting to take shape. Talking to Paul Seitz, solid waste manager, there is still a big push to get additional ROEs so the cleanup can continue. You know, there are a few properties that are trying to fall through the cracks, and we're working hard at trying to catch them before they do. You know, just some oddities, some things where there's a property that appears to be bank owned. So we're trying to find the correct person to actually sign the ROE. Paul's working on chasing that down. There's some other properties that maybe kind of almost slipped through the cracks. Some neighbors are calling about some of them. And so we're trying to make sure that we keep all of those kind of corralled up so that they don't actually slip through the cracks, and that we get that stuff cleaned up. But like I said, things are going, I think now as well as can be expected. Every day I go up there, you can definitely tell the difference, and we're all headed in the right direction. So any questions?
Questions or comments, commissioners?
Mr. Chair.
Go ahead.
No questions really, just a comment that it sounds like encouraging progress, and hopefully as daylight hours extend and weather improves, that maybe the pace can pick up even more. Thanks.
Yeah, I would agree with that, Commissioner Hall. I know last Thursday was kind of a sloppy mess, and anytime, you know, a contractor is working on dirt, when you kind of get that top layer saturated, it does actually slow the process down just ever so slightly. So yeah, a good couple weeks of good dry weather would be nice right now, but they're proceeding without that. The good weather will eventually come on its own at some point in time.
Commissioner Jacobson.
Yeah, just a couple things to add. The money we got from the legislature was $725,000. That was voted on last Friday and approved. We did avoid bonding, so we were under $1 million, or at least that's my understanding. So we should be getting the money fairly quickly, though no one seems to have a timeline on what fairly quickly means. So, you know, we'll wait and see, but push on it. And this will fund the extension of our mental health core program past 8/1. When their FEMA grant is going to expire, it's going to fund the county standing up a septic program to do inspections and possibly repair replacements, and also doing some repairs on private water systems. The state already has a testing program for private wells and springs, but if that report comes out badly, there's no money for people to potentially fix those. So that's what that funding is going to go towards. Well, our original request was actually a little larger. It was about $125K larger, I think, Council Belmont, something like that. And that was to do a one-time fix of public access roads. I see Wayne's microphone turning on.
It was actually more than that. It was another about $250,000.
Okay, I was off 100,000, but there's lots of pots of money right now. Sometimes I get them confused, but that extra money was supposed to be for kind of a one-time repair of public access roads that survived the initial fire, but have gotten fairly beat up in the process of recovery. If you think about trees being fallen on those roads and large trucks going by and construction equipment and et cetera, et cetera, et cetera, they've been fairly beat up. And unfortunately, the money for repairing those was yanked out of our request. So we still need to find some dollars somewhere for that, but we're working potentially on some other sources. I know I am working on that, and Council Belmont is as well. Additionally, we had a request a couple of weeks ago to help find a more temporary solution to water up there, with people still living on their properties or living in trailers and not having access to portable water. So I know the sheriff's office have been working on that one and actually delivered a bunch of water up there Friday. So we did make some headway on that issue as well. So those are updates for me.
All right. Anything else from Director Kenyon or Council Belmont?
Nothing more from me.
All right, you may already know this, Director Kenyon, but as a former banker, the department you want to talk to at the bank about the site they may own up there would be the other real estate owned, otherwise known as Oreo. But there should be a other real estate owned department, and they would be the group handling the properties that are owned by the bank, similar to our own county department that handles foreclosed properties. So I don't know if that's helpful or not, but for what it's worth.
I will pass that information on. Thank you.
You bet. All right. If there's nothing more on the fire situation, next item would be commissioner reports, and I'll go to Commissioner Hall first.
Thank you, Mr. Chair. I do not have anything that we haven't already discussed, so I'll keep it short and simple.
All right, Commissioner Jacobson.
Yeah, I spent all day Thursday and Friday of last week on Division of Land Conservation and Development meetings. I'm one of the commissioners on their board, or on their commission rather. And one of the things I did not know that they had put in a funding request in through the state, a bill package, which I was excited to hear about, is they recognize that local planning departments, especially those impacted by wildfire, are really strapped right now for resources with kind of a record number of permits coming in. People are building right now, but in addition, permits for getting homes back on the ground for wildfire. So they have put in a funding package to actually get funding from the state and then either contract or hire help for wildfire affected counties directly in the planning department with planners that are able to do the job. So I was very excited to hear that. We would be, if passed, one of the counties that would benefit from that. So just wanted to get that out so that possibly the two of you could throw in support for that as well. And our planning director, I'm sure, would be supportive because, like I said, you know, we're really having a hard time in planning right now, and I think this would help a great deal. So.
All right, good news, thank you. I will pass on a report at this time. Next on our agenda would be public comment. Casey, can you pull up our records on public comment since our last board meeting, please? There you go.
Chair, Christy Peter said that most of the input coming in that she loaded today was primarily on STRs, and just to remind everyone that that is packaged together and featured down here.
Here we go.
At the bottom of the short-term rental page, but you can see that actual input right here. Yeah, go ahead.
Okay, so if you click on that link, you'll see what we now see.
Correct, yeah. Yeah.
Okay, just so the public understands.
Yep.
All right, so there's a record of public input since our last board meeting. Anything else to come before the board? If not, next meeting of the Board of Commissioners will be held on Monday, March 29th at 3 p.m. It will be a virtual meeting. And I'll also note that the following Tuesday, March 30th at 1:30 p.m., we'll have our second MT budget meeting. That was originally scheduled for earlier today, but was postponed until next Tuesday. So that also will be a virtual meeting, but with all three commissioners present, it is necessary to publicly notice it. Any last comments? All right, with that, we are adjourned until Monday, the 29th at 3 p.m. Thank you all.